Hi, I'm Marissa Hakker recording. We have Jessica Navarro and Joseph Simington, and we're doing adult ventilator initiation. So our first step is going to be to check the physician's order, which include the mode and the settings that the patient's going to be on.
So we're using volume assist control as our mode, and we have a 70 kilogram male as our patient. So we have Puritan Bennett 840 as our ventilator, Fisher Paykel heater.
Okay, so then we're going to maintain a sepsis.
Washing our hands and gloving up.
Okay, we're going to select and assemble the appropriate equipment.
So we have a water bag.
We have our circuit.
Heater wires through it. Wires for our Fisher Paykel heater. We have a reservoir for the water. Oxygen source. Electrical source. There's actually an outlet right here. And that's it.
So now we're going to assemble the equipment. You want to make sure that you plug it into a red outlet that ensures if the power goes out, it'll be plugged into a generator still operating. You want to plug the vent into an air and O2 gas source.
To connect the oxygen, I'm going to put it on about 50 psi.
We're connecting the heated wire circuit.
You should also have a filter 2 in from the patient also before you hook up the circuits. And I'm going to cut it on.
So now we're going to test the equipment for proper function.
Turn on the ventilator.
Push the SST to test. We're selecting heated wire, adult patient, accept.
And these are the things that the vent is testing. The flow, the circuit pressure, the leak, the expiratory filter, the circuit resistance, and the compliance. Okay, so after the vent is passed all of the proper testing, we're going to adjust the ventilator to the ordered settings.
Settings we chose for the 70 kilogram patient, we have a 700 tidal volume, we have a respiratory rate of 10, we have a FiO2 of 100%, PEEP of 5, flows at 50, we have a ramp waveform, and that's it. Those are the patient
Okay,
settings.
we're going to observe the ventilator's working pressure, which is the peak pressure with the test lung. You can see the peak pressure. It's in a normal range, working along with the test lung. We're going to observe proper function of the ventilator. We've got no alarms going off. Everything's functioning. Make sure the patient's connected to the ventilator. The patient's connected to the ventilator. And we're going to adjust the ventilator alarms. And the apnea setup's always going to be what we have set above. So after we've monitored the ventilator's parameters and everything is in order, we're going to get an ABG and attach a pulse ox. If necessary, perform airway care, including suctioning and oral care, checking the cuff pressure, ET tube placement, and the depth. We're also going to clean up our area and document all the information in the patient's chart. And that was our video on adult ventilator initiation.